Hello, I'm Sarah Wilson. I'm a research assistant and PhD student at Newcastle University. And today I'm going to take you through a bit of work that we've done identifying key underserved groups at risk of digital exclusion within healthcare. And this is on behalf of the co-authors, Claire Tolley, Riona McCardle, Robert and Sarah Slight. Digital health technologies, such as the NHS app, that have been designed to improve population health, have grown exponentially over the recent years. But there are growing concerns that different demographic groups are at risk of being digitally excluded due to barriers they face around accessing technology and accessing connectivity such as Wi-Fi. They may also be unable to use the technology due to poor digital literacy skills. They may be unmotivated to use the technology because they're unaware of the health benefits the technology can bring. And also some people may experience a lack of reliable data from the technology due to the sensitivity of sensors being unable to provide reliable data across different demographic groups. So to improve the inclusivity of healthcare systems, we decided to set out to identify who exactly is at risk of being digitally excluded, so then future work can go on to improve the healthcare systems and the technology. So in our literature search, we use engines such as Google Scholar and PubMed, and avoided using any terms associated with unique different demographic groups to avoid any bias in our results. But we did use terms associated with digital exclusion and health inequities. Then in the results, we only included papers that were published in the English language, identified groups who are at risk of being digitally excluded within healthcare, and also those that examined the reasons why they might be at risk. We ended up with 22 papers that met our inclusion criteria, and we identified 6 common demographic groups that are at risk of being digitally excluded. So the 6 demographic factors that were identified include culture, so this includes things like ethnicity, language and religion, and these groups are typically at risk of being digitally excluded due to things like bias in artificial intelligence models used within healthcare systems, a lack of different language settings available in different technologies, and also a lack of consideration for different religious holidays. Then those with different limit conditions, so visual and hearing impairments, typically find it harder to use the technologies. For example, someone with visual impairment might find it hard to read something on a small screen. And then those with a low educational attainment, so GCSE level or below or equivalent, might find it hard to use the technologies because they don't have the digital literacy skills there to aid them in using the technologies, or may lack the understanding of why they should be using them. And then those aged over 65 are more at risk of being digitally excluded because typically the lack of experience in using the technologies, they may not have the confidence in using them, and also they might be having fears of scams in using such technologies. Then we'll have residence factors, so those who live in rural or deprived areas and those who are homeless are typically at risk of facing barriers to actually accessing connectivity, so things like Wi-Fi or actually getting hold of a device. And then we'll have those on a low socioeconomic income. So those on a low socioeconomic income are more likely to face barriers to actually accessing things like a smartphone or actually affording broadband. Then this black line across represents intersectionality. So this just means that if someone is a part of 2 or more of these groups, they're at even higher risk of being digitally excluded. Then this all forms the CLEARS framework that we've generated from the results of our study. So the take-home message from this work is that we must involve all the CLEARS groups into the design, development and implementation of any technology used for a healthcare purpose in the hopes of improving digital health equity and reducing digital exclusion within healthcare. We also highlight that future work is needed to design tailored digitally inclusive strategies to support individuals in the CLEARS domains to overcome those barriers they face in being digitally inclusive. And on that note, I'd just like to thank the co-authors for their support on this work, and also thank you for listening.